Dear viewers, I Ume Hafsa Khan welcome you all to Noble News Channel. Today we are here at Metro Dental Implant Center, Kalyanagar, Bengaluru. Today people are more concerned about their teeth.
Function and aesthetic.
Okay.
So function, it is because they have. Now they are very much concerned. They're chewing efficiency. Have their better, look. The appearance matters a lot, which will be fixed on the tooth. Your smile is enhanced because of that. Yes, you've not taken any painkillers or not? This is paining. Your tooth is almost gone. It is a proportion if you would have noticed now. It is gone. So it is not in a state of filling or so this you can get it filled, not a problem. This is fine. It is shaking also. So what happened? You try to bite something very hard, or how did that?
No, actually, I used to do septic.
Yeah, that's right.
So this also, since it is shaking, the pain on and off which you have, that is because of infection. It is not in the state of healing. Only if you see antibiotics, you start with antibiotics, the infection will come down, then you can give the effect of climate to whatever the treatment is. So you can feel damage.
Can I start
in between? In between you can take, not a problem. But make sure you.
Today we are here at Metro Dental Implant Center, Kalyanagar, Bengaluru to meet Dr. Haleema Sadiya, who is a dental surgeon. Welcome to Noble News Channel, ma'am.
Thank you.
So, is tooth becoming a hereditary because it is said it comes from parents to children?
Yes, tooth diseases, basically you can say it is hereditary. It do runs in the family. So not all the diseases do run in the family. There are few wall eruptions, there are few eruption patterns, there are few diseases which do run in the family. See, 30% of the diseases which is in the family do comes in the children. So it is hereditary. Not all we can say it is, 30% we can say it is hereditary.
How can we take care of a decaying teeth?
Okay, so taking care of a decaying teeth is basically first you notice that there is a decay teeth.
Okay.
See,
how is it possible to notice?
That is a good one. Here in Indian tradition, it is in Indian culture, patient walk into a clinic only if they have pain. You don't have pain, that doesn't mean that you don't have any problem. See, sometimes there is a tooth decaying happening, there is a oral condition which is getting worse, and still you don't notice it.
We don't consult.
So yes, and what you exactly have to do is you have to make a regular visits to a clinic, regular dental checkup. That is very much important, wherein a dentist is a better person for you to tell whether that tooth has to be taken care in an early stage or whether that needs a treatment or whatsoever. So that is how you will basically take care of the tooth disease progression. and also the decay at the initial stage. When you notice there is a decay, you will go for an initial kind of treatment, wherein that can be treated with early fillings, it can be treated with early root canal. Once the tooth gets an hopeless condition, what you have to do, then you have to go for extreme procedures like extraction, then replacement, and all that. The procedure will basically goes on increasing.
Okay, when small baby develops this some teeth disease, it is like should we be corrected then or there, or we should wait till the milk teeth
falls? We are talking about the milk teeth here. Any condition for that matter, any disease for that matter, when you notice that there is something wrong, you have to treat it at that point.
Then and there
itself. Now you're talking about the milk teeth. Milk teeth basically starts or erupts by the age of 8 to 9 months.
Yes.
Okay, and it stays for like 11 to 12 years. And this early stage of life, the baby is totally dependent on that particular teeth to eat and chew.
Yes,
his normal food. And now any problem with that tooth, any pain or any kind of discomfort, what happens, there will be totally loss of chewing ability, there will be total loss of function. So that tooth problem has to be corrected at that particular point of time. And you have to make sure you retain that tooth in a healthy stage, so that the erupting permanent tooth is in a healthy stage.
See, why it is a treatment of tooth to decaying is very expensive now. Earlier it was really cheap. So what would you like to tell about?
Earlier, matlab, like which stage you are referring basically? See, expensive, I do agree. A normal simple dental setup with a normal single chair unit, X-ray unit, and the equipments what we require comes of high cost. These days, whatever the instruments we are using, whatever the dental equipments we are using, it is all upgraded. Okay, unlike before, when we used to have treatment getting delayed, we used to have your frequency of appointments, your duration of appointments.
You are telling me now, earlier it was not upgraded, now it is upgraded. This reason it expensive now.
Now we are using expensive. It is quite everything is getting more technical. In past time it used to be more manual. Now it is getting more technical, and the treatment duration, the frequency of the treatment, it is getting shortened. These now in this generation, time is more expensive. So if the patient doesn't have time, the doctor doesn't have time. So we have to minimize the number of appointments, we have to minimize the duration of the appointments, and the instruments whatever is there and the materials whatever we are using, we have upgraded into a more better instruments and better material to provide the better care for the patient. The cost is directly related to the instruments and the equipments which we are using these days.
Even the dentures were not costing.
Okay.
So what about the dentures now?
See, denture is a very age-old thing which they were using. Now denture also, the material what we are using for the denture, and that has been upgraded. That is point one. And the thing is that nowadays the most recent one which has come is implants. Implant has replaced this denture thing completely. See, this denture is basically a removable appliance which we give to the patient. Okay, whereas now the implants have come wherein we are educating patients on getting a fixed prosthesis, getting a fixed implant, getting a fixed denture.
Fixed implant for the years or a months?
No, it is for lifetime. We give a lifetime. The denture is like, it is removable. Wherein when we give implant, the patient will have fixed tooth, exactly same like the natural teeth. So it is basically we are mimicking the natural teeth. That means obviously the cost will go high.
How can we protect our teeth?
See, basically a basic oral hygiene routine, like for example your toothbrushing and the proper use of toothbrushing technique, regular use of your mouthwashes, you're using floss and using these interdental brushes what we suggest. All this has to be followed, and with regular checkup, regular visits to your dentist. So that is how you protect your teeth. Over a period of time, what happens, there will be changes. 30% of the population over 34 years will have at least one decay. It is not like my tooth is healthy, my oral condition is completely healthy.
Even if you follow a healthy or a hygienic procedure in daily life, but definitely you will get a...
Exactly. You need a dental cleaning. You need a scaling. That means it is done by a dental professional who will be, expert in that particular. Your brushing technique will not help you completely. Yes, it does taking care of your, eradicate your bacterial infection and all that. but over a period of time you do need a dental checkup, you do need a dental cleaning, so that you maintain your oral hygiene completely.
Okay. So it is necessary to consult a dentist once in a year for every person?
Yes. According to American Dental Health Association, they have recommended you have to have a visit with a dentist once in 6 months.
6 months,
Once in
okay.
6, but once in a year is acceptable. See, once in a year, what happens? Your tooth, your gums will go into some kind of changes over this period of time. A year back, how your tooth and gums was, it will not be the same a year later. So that is how the best person to tell you, the best person to guide you over this year, whether you need a dental treatment, whether you just need a scaling, you just need a cleaning for that, or you just need to take care of it properly, the dentist will be a best person to see. That is why you make a visit. It is like a regular checkup. You do. I am not telling that you go every year and get your surgical procedures and everything has to be done. No, once it is in the proper set, the dentist will tell you it is fine. You just carry on with your normal brushing techniques, carry on with your normal oral hygiene maintenance technique.
Are required.
Yes. So period of time the things will change. Your oral health will change. Your cavities, developing cavities, you might have gum disease, you might have developed a few decays. Whatever that is detected by a dentist only. See, cavities and gum decays at the early stage, it is not painful. As you asked me, it is not painful. So you will just neglect it. Since I don't have pain, I don't have to visit a dentist. No, it is a wrong concept. So at least a year you have to visit a dentist so that you have a regular checkup.
Today people are more concerned about their teeth, but before earlier people used to neglect their teeth. Why?
Yeah. See, today teeth, it is for the maintenance of form, function and aesthetic.
Okay.
So function, it is because in past those days people were not very much aware of the function. They were not aware. Even if they have lost tooth, they were trying to eat with the tooth whichever they have. Now they are very much concerned. They're chewing efficiency. Whatever the food we chew, that has to be chewed efficiently so that it will digest it efficiently. One, that is the function. And the form. See, basically your outer facial structures will change once you lose the tooth. Your gums, your jaw line, your jaw, everything, there will be changes. And the patient are more concerned these days. And the aesthetic part. Aesthetic is basically the look wise. Patient are more, especially teens these days, especially they are very much concerned about their looks. So they'll do every possible thing to enhance their look. Like it is like how you do a makeup. It is like cosmetic dentistry is enhancing these days. We have something called Hollywood smile, wherein we give a perfect smile. Like how these actresses they have, we try to mimic that. So patients are very much liking that concept now these days. Everybody wants to look good. They want to smile good so that they have their better pictures. They have their better, look. The appearance matters a lot these days. So that is why we have cosmetic dentistry, wherein we basically focus on the designing, smile designing, and we have something called smile jewelry. We have this tooth jewelry also, wherein we have this diamond kind of a thing which will be fixed on the tooth. Your smile is enhanced because of that.
It is more brighter.
Okay. So all these thing is getting more. So that is what these days smile design, Hollywood smile and smile makeover is trending. So that is why people are more concerned about their teeth as a aesthetic part. They are more concerned.
Okay. Today we met Dr. Haleema Sadiya, a dental surgeon who helped us out by sharing few important tips how to take care overall dental health for healthy well-being.